Hey everybody, Dr. Sean again from Gallagher Performance. Today, putting together a little bit of a video to help those that are dealing with back pain that may be due to discogenic pain or disc bulge, disc herniation. Some of you might be dealing with sciatica, or those of you that are just having back pain due to a recent sprain, strain, and are in need of some strategies in your daily routine to help keep you from irritating that area of the low back. And some tricky ones that everybody deals with on a daily basis is getting in and out of chairs, so typically from sit to stand, bed, rolling in bed, turning over can be highly problematic and painful, and as well as getting in and out of cars. So today we're going to go over some tips and cues to help you through those activities, help you protect your back while the injury heals and safely return you to a normal status of everyday activities, exercise, and so on. So to begin with, let's talk sit to stand. If I demonstrate by backing up towards this bench, one of the things that commonly people will do as they are seated and as they stand up is they will create rounding in their low back or flexion. And flexion isn't a movement that our backs will tolerate well, especially if there's a disc problem or some sort of injury related to what they call a flexion intolerant back. So it becomes highly important to avoid flexion and be aware of our postural control while we're seated, but also while we're moving. So if I sit towards this bench here, what I want to think about doing is keeping my hand in the low back, and if I feel any rounding into the low back, I'm losing control of my lumbar spine, creating flexion, and that has been shown to be a mechanism of injury or a mechanism that is repeatedly involved with flexion intolerant backs, disc injuries. So we'll want to sit, keeping our chest tall, spread the knees with the glutes. So from a head-on standpoint, we don't want the knees folding in. We want to keep our knees nice and wide over top of the ankles and sit back, keeping the chest tall. Standing up, keep the hand in the low back, create a little bit of brace with the abdominals. If someone's going to hit you from the side, you want to feel nice pressure within the abdomen, but adequate. Sometimes too much pressure can irritate the low back and irritate the disc. So we just want adequate. We don't want too little, we don't want too much. Find that brace. Now, using the glutes to hold the knees out, keep the chest tall, use the hand in the low back to monitor if there's any change in your lumbar spine curve, and then you're up. From the side, it would look like this. Again, hips go back, we're not rounding, hips go back, down, chest tall, use the glutes, spread the knees, and then stand up. Another cue I like to use is push the floor away. So it's not so much about standing up with the legs, but think about pushing the floor away with your feet as you stand up. That should help with sit to stand. Secondly, as I mentioned, most of us will have problems with rolling in bed. If I get down to the floor, what becomes problematic when someone's laying on the ground is if their shoulders open up before their hips do, because now we're creating too much rotational stress through the spine. So what becomes advantageous is to roll the hips and the knees as one unit. Again, we want to lock in the rib cage, create a brace, as we did when we were doing our sit to stand, and we can use our bottom arm as a lever to help push us in one fluid motion and roll control to the other side. If I did that now from my right to my left, bracing, shoulders, hips are locked together, so my shoulder is not opening out first. I'll use my right arm to push me. My left leg can create some momentum, and then I roll over. Again, that will help spare the low back, take some rotational stress off of it. Now we're going to kind of couple those two together in order to help us get in and out of cars. So if this bench was my vehicle, a lot of us just simply want to kind of sit in all in one motion, but when we have a sensitive low back, that typically is not happening. So what we want to do is engage and utilize some of those strategies that we just used from sit to stand and rolling in bed. So I want to keep my backside to the car door. As I open it up, now I'm sitting down into my seat, just like I would a chair. Braced, hips go back, chest is tall. Now, to get into the vehicle, I still want my shoulders and hips to move as one. I'll lift my leg, try to keep it all locked together. And now you're inside the car, pull the door shut. Again, if you're getting out, lock the shoulders and hips together. Again, we don't want the shoulders to lead and the hips to follow. We want everything to move as one. Feet come outside, set the legs, knees out, use your glutes to hold them, brace, chest tall, push the floor away with your feet, and you're good. Again, those are some tips to help you through your day if you're dealing with low back pain. And always highly encourage you to seek medical evaluation. At Gallagher Performance, we're here for you, for your back pain complaints, and help you return to normal, healthy, everyday activities.